Yeah. So this is my first live I've ever done, and also my first microneedling I've ever done. This is with my pen, Candela Exceed. I've never had microneedling done before, and so my friend came over and is so gracious to do this for me. But I tell everybody that it doesn't hurt, and it's true, it doesn't. I'm a wimp. I don't like doing this stuff, and I definitely don't like doing anything painful. But this feels like a toothbrush. I don't feel anything. I haven't felt anything yet. I'm sure it's going to have some spicy areas because it does, even on my patients, whenever I do around the eyes or around the mouth and the lips, especially for wrinkles, I get more aggressive. So it's supposed to get a little spicy around there, but this is not bad at all. This is great. And I don't know what I'm doing with a live, y'all. I've never done this before. So this is the time of year, though. Oh, and my face is red in some of these areas because she just did my laser on me also, my Airlace Neo Elite. We did laser first and then zapped these little blood vessels on my face and try to get rid of some of my summer sun damage. And now we're also trying to get rid of some of my melasma and all that stuff.
That looks so good.
Thank you. Yeah, this device, so I used to use Skin Pen, and Skin Pen, I mean, I never used it personally, but I could tell on my patients that it was very uncomfortable. You could see them wincing. It just looked really uncomfortable. And then they got real bloody. And that's the thing you see. So a lot of people talk about vampire facials. And so all the vampire facial is just drawing your blood, taking the PRP, drip it on the skin, and then microneedle it in. And you're supposed to get real bloody from the microneedling. But with this one, with Candela Exceed, you do not get all that. You don't have to induce collagen. You just get pinpoint bleeding at most, and that is all you need for the benefit. And I mean, you can see it doesn't hurt for sure. I'm waiting on it. I'm gonna feel something, I know, because it's gonna have to hurt somewhere. I'm worried about around my eyes or my lips because I know that is where it gets a little bit touchy, but
Yet to see anybody have a problem with this.
I don't even know how to stop this. What? There's not a button. I don't know what to push. I don't want to do the whole thing because I don't.
The Truman Show, then.
Yeah. Should I do the whole thing? Are you supposed to do the whole thing?
I think you should. Is anyone watching?
Yeah.
Good.
Okay.
Maybe they have questions they can ask you.
Oh yeah. Whenever I watch these things, I see people ask questions. Yeah. Feel free to ask me questions. So I guess I have to watch all the little little comments and stuff.
Yeah,
no.
So good and red you're getting.
Yeah. This is quite pleasant.
You don't have any nasolabial folds, but we're going to prevent them anyway.
I've got a little bit of like jowling, marionette line stuff starting.
Okay, we'll get those.
Okay, thank you.
Maybe somebody wants to know how often you do it.
Oh yes, good idea. So, definitely you could get this done once a month for sure. I'll put this up there because I know you have to pick up the nose. Nobody wants to look up my nose. So yeah, you could do it every 4 to 6 weeks. I do have a new special actually that's starting for fall, and it's a really good deal. You can have 6 combinations of microneedling or the Airlace Neo Elite treatments. So you get 6 of either or, and it's really like it's based on your skin type or what you're trying to achieve. So if somebody has more of a texture issue, I'm going to do more microneedling. If it's just rejuvenation, trying to take care of browns and reds and erase some summer sun damage, then I would do more of the laser. But it's a combination of 6, plus you get 2 glow peels, plus you get 4 pharmaceutical or medical grade skincare products, and it's only $6.99 down and then $2.71 a month. Yeah, I know. So it'll be real good to get you ready for next spring and erase a lot of the stuff from the summer and I know, all the past years.
You like using this for hair as well, yes?
Yeah,
The
you can
scalp.
microneedle the scalp too. Yep, you can microneedle the scalp to help with hair restoration.
Acne scars.
Yep, it does great with acne scars. Anytime you can try to get some collagen induction over those acne scars. And you do have to work harder on acne scars for sure, but just definitely know that it's going to be a process, but you will get there. And it is a slow process with anything. These are called collagen induction therapies. And so whenever you induce collagen, collagen has to take time to build. And so, I mean, that can be 3 to 6 months that your collagen is going through that process. But after you get one of these, your max result from it is 3 months later. And so, if you're trying to get to an end goal, you want to do 3 or 4 of them, and then you just let it continue to improve over time because it'll look better 3 months after your last one. So definitely by the time you get to that, it's going to start looking really good.
What kind of things do you like to do in between when people have finished their microneedling regimen and they need to do other things? What other things do you like to do for their skin?
Well, that's definitely skincare for sure. If you're spending money to do stuff like this, you definitely want to get on like medical grade skincare, really good products to help protect that investment. And I always tell people because they want to know the difference between like medical grade and what they can buy at the drugstore or actually online and the other places. Ulta, is that it? So obviously I don't shop there. I think I've been in there one time, but places like that. So there's a huge difference between medical grade and regular skincare as far as the actives go. You got way more active ingredients. They're also formulated to penetrate the skin better. And so they go deeper into the skin to really do what it's supposed to be doing instead of just sitting on the top of the skin. So using that medical grade skincare is, and I don't know if this is a good analogy or a bad analogy, but I use it a lot too to tell people, okay, think about it as if a doctor's giving you a medicine that's like a 10 milligram. That's going to be like your over the counter, but then you go get the 100 milligram and that really works. So something like that is easier to understand. You're going to be getting a lot more active ingredient that's going to be working to protect you. Alternating this with anything, I mean, chemical peels are great. Chemical peels are going to work on the top of the skin to take off like a little layer and a lot of stuff, fine lines, wrinkles, the discoloration on the top of the skin. And then this is more, it's taking off that, but it's going deeper to induce more of that collagen. I haven't felt a thing yet.
That's amazing.
I can't believe
We're
it.
pretty deep right now.
Really?
Well, yeah. We're kind of maxing you out on the depth here.
Oh, wow.
Yeah, because we want to make this count.
Now, I am numbed, everybody. You do numb for microneedling. But you don't have to numb long, like 15, 20 minutes with what I have. But, I do have some pretty good, strong stuff for my numbing because I have soft wave. And so, and I don't like pain, so I don't like for my patients to have pain.
You're not mean.
No, No, I want them to come back to me.
Now, what should people do to get ready for a treatment like this?
So also too, I mean, it is good to, if you already are on good skincare, for sure, that definitely will make your results better. But you do have to be careful. You're not supposed to, have sun. You're supposed to stay out of the sun because whenever I heal, while this is healing, this is like brand new baby skin. You don't want to damage it. So you definitely want to stay out of the sun. You definitely want to wear your sunscreen and be careful. But before, also, you don't want to have any kind of a sunburn. If you use retinoids or anything like that, you want to stop those. Some people are more conservative than I am. I've been in derm for 25 years, so if anybody ever has a problem, I can fix it. So you don't. I just say that for your retinoids, just be off of them for even maybe a few days. I'm fine with. They don't have to stop it for 2 weeks or anything like that. I actually think it helps your results. So that's the first time I felt a little tiny bit on the upper lip.
Right there?
Yeah.
Yeah.
And that's
Get
it.
you right on the filter. I'm sorry. Lovely.
Well, that wasn't much.
Okay.
I mean, I felt it a little bit, but it wasn't bad.
Okay. If my patients aren't jumping off the table, I just keep going.
Yeah. No, this is not bad at all. I'm so glad I bought this device.
It's amazing.
It really is.
I like that it's not pulling or grabbing your skin.
No. That was one thing about Skin Pen. Whenever I used to use it, it's like you could just see it dragging the skin. And it's the number one. Is it still number one?
I don't know.
I know. It's the number one. Yeah. Microneedling device that you hear about because everybody has it. But when I used it personally, I was not impressed.
And this one is FDA.
Yeah, FDA approved
cleared.
For 2 indications.
So I think that makes a big difference too.
It does.
I mean, there are Skin Pen is FDA cleared for different indications. But there are a lot of providers out there who might not be buying FDA approved devices.
Yeah. Oh, that is one thing because, so a lot of people, if I see somebody advertising a microneedling for like $199 or $99, you can almost guarantee that they got their device on Amazon. It's a cosmetic microneedling pen, not a medical grade microneedling pen. In order to have medical grade, you have to have a license in order to buy it. And so you can't just buy it online. You have to have an account and you have to have a medical license in order to get it. And so, you're getting a safe device that's backed by the FDA. It has studies to prove its efficacy. You can, people that buy devices like that online and then try to use it in a medical setting, I mean, that's just not safe at all. So there's needles in this little head. There's like little needles that are going into your skin fast over and over again. And you have to have that head, actually like, I don't know, how do I say this? It just needs to be safe. Blood can back up because if you do, you are puncturing the skin. So, there was a big problem in Texas where they were using something that was definitely not FDA approved, and they were actually, was it hepatitis and HIV? They were giving people diseases because they were using a device that is not regulated. And so with these, there's no possible way. You throw these tips out, use a new one every single time, and it's a closed system. There's no way the blood backs up in there.
It's one of the most well thought out designs I've used.
Yeah. And so this is corded, and a lot of people they think that the battery is better. It is not. We have problems all the time with that battery.
It's heavy.
Yeah, it's heavy.
And it dies. I just wanted to go back over that a little bit, Misty. How do you look?
So that is how
Gorgeous.
We look at the end of our microneedling session with Candela Exceed. I didn't feel a thing. I can't believe it. Because I'm telling y'all, I'm a wimp, and I was just like ready for something to hurt. I felt a little bit whenever she did it right there. So I've got my event tomorrow. For those of you that are coming tomorrow, our Aquafirm event, y'all will see me. So tonight, I still look like I've had a sunburn. Tonight, it'll still be pink. But tomorrow, I'll just be a little bit pink, and I can cover it with makeup. So no big deal. Send me any questions if you have them. Y'all have a good night.